Hey everyone, this is Dr. Ryan at Primal Chiropractic, and in today's video blog we're going to be discussing something called lower cross syndrome. Lower cross syndrome is a combination of a couple things. One, we have a lot of over tight muscles that pull our bones in certain ways, and in combination of that, usually if there's over tight muscles in one area, there's overstretched and weakened muscles in the other area. This typically stems from posture-related issues. However, there's many causes for it. We're going to start locally where it originates. So what you'll see commonly in a lower cross syndrome is what's called an anterior pelvic tilt. So if you focus on the pelvis, it's where we have this heavy rock where the pelvis is rocking forward. Now what that does to the low back or the lumbar spine is it overarches it, creating a lot of crunch with the joints of the vertebrae. So if you're experiencing low back problems, it could be because of this postural presentation. Now the next area that can get hit is the hip joint, the ball and socket joint. Now again, with the ball and socket joint, the ball of the femur or the leg bone sits upon the pelvis, and if we have this forward rock, it completely changes the anatomy on how the pelvis is sitting on top of the hip. What this can cause is a lot of hip impingement. It can create labral issues, osteoarthritis over time. So we want to make sure that we correct how the pelvis is sitting on top of the hip joint. It's also going to create a big lack of range of motion in certain directions. So if you do come in office for a lower cross syndrome, we're going to be testing all 6 planes of the hip. We usually will test flexion extension, internal and external rotation, and what's called adduction and abduction. The next area that a lower cross syndrome can influence is the knee joint. So 9 times out of 10, we have weak glute muscles. They're not firing and not used how they should be. When that occurs, we'll have crashing of the knee. Now this could be with a squatting pattern, maybe a knee lunging pattern, walking, running. A simple test that we can do, or we can do a lot of tests, is just standing on one knee. If we have a collapse or a hike of the pelvis, we know that the glute is not firing the way that it should be because the glute is a huge hip stabilizer. So from here, if you're experiencing knee pain, we want to start targeting the glutes to make sure that they're firing the right way. One of the last areas that it can influence is the foot and ankle. We're talking Achilles tendonitis, we're talking bunions on the big toe, and we're also talking plantar fasciitis. Now the reason why this can happen is, again, we're going to go back to the glutes. If they're not firing, naturally we're going to have the crashing of the knee, or what's called internal rotation of the femur. If that happens, if you watch my foot, it's going to crash the arch. When the arch is crashed, it now flattens and overstretches it, which can create that plantar fasciitis presentation. That can also create bunion formation. So whenever we have too much pressure on the inside of the foot, that's how bunions occur over time. Also, that's how a lot of Achilles tendonitis issues do happen. So this is how we address a lower cross syndrome. It's not always the low back pain. It can be going all the way down into the foot. And if it is, it's going to seem weird that we're training core, we're training hip, we're training knee alignment with ankle alignment. This is what's called a global rehab presentation that we like to do a lot. So if you're experiencing any low back pain, hip discomfort, knee or ankle issues, give us a call and we can let you know if it's from a lower cross